Hello, Internet. My name is Rob. I'm a 29-year-old powerlifter, and I tomorrow I'll be undergoing hip surgery on a torn labrum in my right hip. So, to give you a little background, labrum tears in athletes, whether it be lifting, running, baseball, football, etc., anything that really has you drive from the hips and the legs, there's a chance that you can definitely injure your labrum or tear your labrum. And basically how that happens is excessive wear in your hip when you have some kind of abnormality, like something like a bone growth or something that's not normal. And what's happened with me is I have a hip impingement on both of my hips. So what this really means is that over time, excess wear from that extra bone caused the labrum in my right hip to tear. I have the impingement in both of my hips. I'm not sure if I have a tear in my left hip, but from the way the doctor's describing it, I should really just focus on the worst one right now, which is my right. Some of the symptoms of having a labrum tear is going to be some kind of burning sensation in your hip or leg. You'll feel it on everything. So, excuse me, when I sit down, I feel pain in my right hip. I feel a burning in the crease of my hip, in the hip groin area. Any kind of squatting, deadlifting, I'll start to feel it over time, if not immediately. And that no matter what I do or what I've done in the past, it hasn't really worked out. So I tried PT first. That didn't work. I tried anti-inflammatories up until about last week, where I was taking them on a regular just to like numb down the pain to kind of go through my workouts. I competed twice with the tear and did pretty well, but I kind of ignored it at first because I didn't know what it was. And the doctor didn't recommend an MRI for a very long time. So it took about 6 months to diagnose, when it probably was torn pretty much early on, when I felt it in September of 2016. So I'd like to keep these videos kind of short and to the point, because I know that there's a lot of good information out there online, but there's not a lot of videos on the experience. So I kind of wanted to document it for myself and for anybody who's maybe interested and has questions. So if you do have questions, of course, you can always comment on any of the videos, and I'll try to answer them as best I can. I'm not a doctor, but I'm a dumb power lifter who has to finally suck it up and get surgery. Some things to expect: there's about a 4 to 6 month recovery period. 6 months to kind of feel ready to start, being confident in my hip again, to kind of do all the exercises again. And I'm going to try my best to recover as fast as I can, but, within reason. I have a lot of emotions about this right now. For someone who lifts 5 days a week and competes fairly regularly, this is kind of a blow to my ego and my whole life, really. I feel kind of bummed, left, kind of depressed, angry, confused, a whole bunch of emotions. And it doesn't help that I always have been looking up information on labrum tears now to kind of figure out, where could I have gone wrong? What was the problem? But really, these things just happen, especially if you have some kind of deformity in your hips that causes excess rubbing, so to speak. So the surgery seems pretty simple. It's about a 3-hour surgery. They're going to go into my hip with 3 small incisions, repair the labrum, and then they're going to, the doctor's going to shave off excess bone on my hip so that when it recovers and heals, there's going to be room there so that I can perform all the exercises that I was doing or any kind of activity, and there shouldn't be any pain. I'd like to try to keep these videos short and sweet as best I can, up to 5-6 minutes, because I know that no one wants to watch me talk for 20 minutes. And I want to try to keep them as regular as possible. So my goal is to kind of take anybody who's watching along on this trip to hopefully get back to lifting competitively by next year at this time, or July really is my goal of next year. And that's really it. So the surgery's tomorrow morning, and I'm going to go under the knife, and supposedly the rehab starts right away. So the next day I'll be doing some form of PT to, I guess, get loose and try to start increasing that range of motion again. And that's really it. So if you guys are interested, keep watching my videos as they come out, and I hope I give you some extra information. There's some great blogs out there that kind of document the experience, but I thought no one's really videotaped it. So this will be a good way for myself to remind me of how far I've come along on this, and also maybe give those who are considering the surgery some hope that you'll get back to where you're supposed to be. So that's about it.